Hello, professors.
Hello.
Laura.
Jocelyne as a neurosurgeon and Grégoire as a neuroscientist. Together you've been at the forefront of revolutionizing care for patients with spinal cord injuries, stroke, and Parkinson's disease. So to kick things off, could you tell us a little bit about your current research focus and its potential implications for these patients?
Our research is encompassing a large pipeline going all the way from basic research, really understanding the mechanism of disease and how to leverage this understanding to develop new treatments, which eventually we will test
in human beings. So what are we working on? Currently, we work with people with a spinal cord injury, and we try to improve the gait and the mobility of the upper extremity. So for that, we've developed a technology that is able to read into the thoughts of the patient and the intention to move, for example, the upper extremity of the leg. And that is, this intention is transmitted to a stimulation of the spinal cord that is then going to activate the limbs.
We are talking about a digital bridge that will turn the thought into action. Mm-hmm. So that's one of our big projects. We also understand that this technology, which stimulates very precise regions of the spinal cord that are involved in the control of muscles of the arm or the leg, can also be used to control blood pressure. Mm-hmm. So that's one of the big therapy. I mean, Jocelyne has a lot of patients with tetraplegia who have problem of blood pressure.
Mm-hmm. That's a major problem. After, in general, cervical spinal cord injury, people have trouble to maintain a normal blood pressure. They feel very weak. They have syncopes. They cannot engage in social life. And we found a hotspot in the spinal cord that we have to stimulate in order to increase the blood pressure again and to have a normal blood pressure. And after this stimulation, it's a switch on-off. You don't have to train people, and they immediately feel better and engage again in normal life.
That's spinal cord injury. As you mentioned, Laura, we also focus a lot on Parkinson's disease. You know that in the later stage of Parkinson, people have problems to walk because the brain does not send the correct information to the spinal cord, which is otherwise normal. So we thought we have an understanding of how to stimulate the spinal cord to reactivate the spinal cord normally. We could use this to improve the gait of people with Parkinson's disease. And now, Jocelyne, you have implanted...
Yeah, we've implanted 3 patients. They all suffered from what we call freezing of gait. You know, they cannot do steps anymore. And with the stim on again and the very little training, they start having a much more fluid gait. And it improves also their daily activities. And they are much better with this stimulation.
As we talk about these remarkable technologies, there's a natural focus on their potential to improve patients' lives, and this aligns with the bioethical principle of beneficence, doing good. At the same time, there's a need to consider the potential risks and unintended consequences that may arise, again, following the bioethical principle of non-maleficence, do no harm. Now, ethical discussions often lean heavily on the risks, but I'd like to delve into some of the key areas where this tension comes into play. So a lot of these devices rely heavily on AI, and one common concern is the lack of transparency in how these AI systems make decisions. So how do you address concerns of patients who might feel manipulated or influenced perhaps by something that they can't fully understand?
In our scenario, we are just sending command to the spinal cord to activate a muscle. Mm-hmm. So in a way, the output of our AI is very simple. It's a command to flex the leg more or less. So the patient see this opportunity more, the capacity to recover control over the paralyzed limbs. So there is not this concern at all what this AI is doing on my body.
We do not penetrate in the intimate thoughts of the patients.
Mm-hmm. Mm-hmm. So there isn't access to that kind of highly sensitive information. Mm-hmm. There's also been a lot of discussion about the potential for these technologies to go beyond healing and to be used for human enhancement, which is something that transhumanists advocate for. Have you encountered this issue in your work, and how do you think that we should be approaching it as a society?
So for our work, we only want to treat patients, and we don't have in mind to enhance a human being. But as Grégoire likes to say, it's something we should think of, and we probably in the future there will be application in which people will ask devices to have a better memory, a better way to function. But nowadays, at least in our projects, it's limited to the normal function, to come back to the normal function.
Yeah, currently the implantable technology for thought reading technologies are really at their infancy. They are so simple that they cannot really be used in a meaningful manner by human beings. So we're still very far from transhumanism dreams. This said, I remember 30 years ago when people announced that one day we will have a video conference with someone on the other side of the planet. I thought I will not see this in my lifetime. So we should be very careful with technology. Breakthrough come very rapidly. And anticipating potential issues is important, especially us in Switzerland. I think we are very well positioned across the planet to anticipate this type of neuroethical consideration. Indeed, we have in Geneva GESDA, which has the role to anticipate all the potential issues with ethics in the brain.
Yeah, and what does mean transhumanism? Does it mean that the device needs to be implanted? Don't we work already with devices that help us a lot, like our mobile phones, that we become also stronger with these devices?
And soon they will be enhanced with AI very strongly. It will come, I think within the next 5 years, our phone will be completely transformed by AI, which will do a lot of things for us. So again, we need to anticipate, leverage this opportunity because it's amazing for humanity. And also be careful that we still have control over our lives and interaction with others.
Hearing about these innovations, they sound groundbreaking, surely though quite expensive to develop. So how can we ensure that they become accessible to everyone in need and not just those in developed nations or the wealthier?
So I think that we can compare the technology that we are now working on with the one that is already existing to stimulate the brain and the spinal cords to treat Parkinson's disease or chronic pain. And the prices should be more or less similar and hopefully going to be reimbursed by insurances. So I believe that the countries that already benefit, the people who already benefit from the technologies that are available will also benefit from our work. So I agree with you that other countries where this is less available, it's more expensive, will still be, for them it will still be difficult to access this.
At the same time, Jocelyne and I, we are scientists, we are passionate about developing treatment. We are in the proof of concept. Our responsibility, mission as scientists is a proof of concept. Yet our dream is to scale up this technology and disseminate them across the planet. And for that reason, early on when we thought we had the potential to create treatment for many, we created a company, Onward Medical, that has this mission. And then, when you perform your development properly, you can convince insurances to reimburse the technology, and that's our goal for our technology.
So if you look forward, say, 10 to 15 years, how do you envision this field of neurotechnology evolving? And what might be some of the challenges that we need to overcome to get there?
So at least we hope to bring a treatment to the patients, which is not obvious, because a lot of researchers have good ideas. They try something that works in one or two patients, and the day it starts to be another business to make it available to everyone, it's more difficult and they abandon. So our goal is to bring a therapy to patients. So will we succeed? That's another question. We make everything we would like to be successful, and that's our goal.
I think you're not ambitious enough. One therapy? We hope that in 10 years we will have brought 5 therapies at least from this center to the people.
But coming from the same principle,
Coming from the same principle. Mm-hmm. And then, Jocelyne is a functional neurosurgeon, so she implants medical devices in the brain, spinal cord, peripheral nerve of people, like every week. And I think over the past, 30 years ago, there was nothing. Today she has many implants. And they have been improving a lot over the past 10 years. And I think within the next decade, we're going to see a revolution in neurotechnology.
So we already see what we need to improve. We know that we will improve the devices. The devices need to be even more performant, need to be faster. The decoding needs to be better. The communication with the devices will improve. As Grégoire likes to say, it's a bit at the beginning of the pacemaker, when the patient with the first pacemaker had a big machine walking next to them to make it work, and now everything is very small, you don't see anything. And we hope that we will follow the same development steps.
I think the key in medical breakthrough is first the concept. This is why we conduct a lot of basic research to understand the principle that we aim to target. Then you need, of course, to find the appropriate technology, but then technology will always improve if you understand the principle. You will always make your treatment better, more performant, and more easy to use for the patient.
And things can change quickly, as you've
Yeah.
shown. Last question, I suppose. If you could address one common misconception about neurotechnology and its capabilities, what would it be?
I mean, there is always the fear, the phantasm in a way of, human augmentation, and especially, with AI, there's a lot of fear around what it could bring for the change in humanity that we will not control, which, some of them are clearly justifiable. So it's our responsibility to just surround this development with the appropriate framework to make sure that this development, this progress in technology are also a progress for humanity.
Well, thank you both for your time and for sharing your insights. It's really exciting to see the field evolving and get to witness your research.
Thank you very much.
Thank you.